The first time I heard Sam talk a little bit about what he does for a living, I was like, we have to have him on the podcast. I had never heard of prevention embedded in the military, and I just cannot wait for our listeners to learn how the military is supporting their active duty soldiers.
Yeah, we've got 2 civilians here, but children of military veterans. So we're thrilled to be able to have this conversation and see where it goes. Welcome to Connections, the podcast from addiction professionals of North Carolina, where we discuss addiction through the lens of policy and practice.
We're your hosts,
Sarah Howe
and Morgan Coiner, and we're here to help you see how it all connects. Today, we are joined by an APNC conference attendee legend, NC Prevention Conference legend, Sam Lewis. You may have seen him running a karaoke booth, playing some music at a bonfire. Sam, welcome to the podcast.
Thank you.
Can you tell us a little bit about what you do to get us started?
So currently, I'm working for the Department of Defense, and Department of Defense has an integrated prevention workforce throughout all of the branches of service. And I'm working with the United States Marine Corps. Today, I am representing myself, but in my position currently, I'm a primary prevention integrator. And I know if you're anything with prevention or anything with addictions, you know what primary prevention is. That's that universal audience. And I work currently as an advisory with primary prevention to the command that I serve. And the Marines.
With families?
I have a family. Yes, I do.
Oh, I'm sorry. Do you work with families then as part of that prevention work?
We work with the active duty service member and their families and their spouses, and we provide an array of services for them, not just in behavioral health, but in a lot of the other risk factor areas that we see inside the base and off the base.
In this field, we predominantly talk about 2 things when it comes to the military: PTSD and veterans who are at risk of substance use or who are in recovery. We talk about all the things that happen after substance use has started, and typically even after it has become problematic. You are on the total front end of that spectrum. Tell us a little bit about what that looks like in the military.
Well, in the military, many of the branches of service are starting to adopt this human performance model that is built on these pillars, these 4 pillars of social, spiritual, mental, physical pillars. And it really follows, to me, what Maslow's hierarchy of needs are. But if to build a deadly fighting force or a reputable fighting force that is mission ready, we can be physically fit all day long. But if we're not sleeping, we're not eating the right way, and we don't have the right things going on at home in our relationships with our spouses, or even living barracks life, I think it's a very, very different time when we start thinking about the fighting force that we have, because the way we fight now is quite different than in years past. Not totally, we still have bombs and bullets and all the things, but the real thing that win wars is our peace and humanitarian efforts. But a lot of the service members that are actively with us right now, they're bringing in those ACEs.
Mm-hmm.
And I think as I have some of my colleagues come here today, we're like, man, we got to educate these commanders, and we got to educate these mid-level leaders, even at every rank structure, what these things are before they come to us in the Marine Corps.
And for our listeners, ACEs are adverse childhood experiences.
Yes.
Many of our listeners are familiar with the field, but we hope this reaches beyond those in our field.
We all experience traumas and things that kind of set us up, to how we navigate life. And we get those folks in, they're like a clean sheet of paper to us. We're like, oh, you're great, you're doing fine. But they bring all that stuff with them. They bring all the traumas and all the things they experienced as kids. And, not everybody gets the same kind of parenting and Things like finances are huge things for our service members. It's not PTSD.
Right.
I'm just going to tell you right now, it's not PTSD. It's relationships are the big things. When they have a big breakup, they can very, very quickly become very, in a bad place. And we do have an array of behavioral health, classes. We have all the, just as many things as we have off base, we have on base. We're providing for our service members and their families. So,
earlier this week at the conference, we talked about gambling for the first time. We really haven't dug in to gambling. And there is a prevention factor there. There is treatment and recovery. Has the military caught up with that? And I say that recognizing most of us haven't caught up with it. So that's not we're all trying to catch up with what we're seeing.
My first 8 years working, I worked for the Substance Abuse Counseling Center, where we're on the very front end of the non-clinical counseling. Folks that are very low on the ASAM score, which the ASAM score is for the folks that are, at mild, medium, or high level of dependency for substances. We would be working with those ones that are on a very low level for dependency. So I would teach the Prime for Life class. And a lot of those folks coming in, it wasn't just always, they would come in, they weren't necessarily at risk for dependency. They didn't have a diagnosis, but they would have, questions about gambling. And there'd be many times we would bring in subject matter experts to come on the base to talk to our Marines about, the risks of gambling, as we've seen, in the past, decade, how we've gotten more and more and more accessibility, skills on the computers, as you guys know, I'm not just a person that can present. I've presented at the conference with creative expressive arts therapies and also military culture on the topic we're talking about currently. But yes, gambling has been addressed. I can't say it's always the easiest thing to push out, because you really can't make service members do anything unless it's command directed.
Sure.
If that makes sense. If the boss doesn't make it mandatory, it's like, we don't have to go to that.
Like that military culture, it's very hierarchical and command based. I mean, it
has to be.
Yeah, absolutely.
And there's information and hotlines and all kind of things that are accessible. I would say that one of the best resources we have, if anybody's out there listening, is a veteran or has an active duty service member child. There's this thing called Military One Source, and it is like the best. You can go to Military One Source, Google it, look it up. It is very comprehensive. Wherever people are stationed at on planet Earth will give you, it will connect you. I think they use AI or something to keep things updated, but it can give you the phone number to a very specific thing. If it's something for education or for something for transition, because every 2 years they're being uprooted and put into a new place.
Yeah, I was going to ask you about that. Because I love that this work includes the families, because there is, yes, military culture for the service members. There's also very much military family culture. Even one of our staff members is married to a man in the military, and there's just a very specific way that she talks about certain things and does certain things, and it's influenced by that environment. And so how, when people are transitioning into, the base that you work at or the area that you work at, what are some of the first steps you do to work with them?
When a service member comes to a new duty station, they have certain Marine Corps orders and rules that you're supposed to follow when you onboard or when you come on board. So there's things like a checkoff sheet. I'm on the checkoff sheet. The primary prevention integrator, they come to my office when I'm not there this week. I have a QR code that's out there, and they click it and they go in there and they ask all the questions that they need to get access to. They may be coming on board. They're looking for childcare. It's summertime's coming around the corner. They're looking for things for their kids to be involved with summer camps. And even we have a program called CRADO, which is our it's an acronym for Chaplain Resiliency Education. But they actually take couples and individuals and they bring them up here to the mountains and take them on wilderness retreats.
Oh, cool.
And it's all paid for. But when they onboard, there's a lot of welcome aboard briefs where the service members are exposed to all of the protective factor things, everything from the chaplains to the retail side of things to We have what they call military family life counselors. They call them MFLACs, and it's a contract through Magellan. So Magellan's a huge provider of employee assistance, employee, counseling for a lot of big companies. I wish they provide me with that with my position. But yeah, just getting them connected with the check-in, and they also have check-out sheets, and they go around to every place as part of that battalion that I work for to get signed in and get familiar with the infrastructure and the people that work in and through the entire organization. So,
is this something that's specific to North Carolina or to, the duty stations we have here, or is this happening nationwide?
Globe.
So
I'm sending guys.
yeah.
Like last week, I sent guys out. I'm like, hey, where are you heading? Are you EASing or PASing? So one EAS means they're getting out, they're exiting the service for whatever reason. And, if you think about the reasons they will be exiting the service, it could be just it's the end of their enlistment package, and they get a clean DD-214. That's the piece of paper that you get when you get out. And some of them are not getting out on a clean DD-214. They might have had some kind of infraction that would have made them have to get out sooner than later. Sometimes it's medical. Sometimes it could be a legal thing. So there's lots of things. But either way, I think our mission I know with the Marine Corps and all branches of service is to send them home better than we found them.
I love hearing that.
And I like that.
That hasn't been out there much.
No.
It is out there.
For us civilians.
The COs, the XOs, and the sergeant majors, and the people that are in leadership, by the time they get to that rank, they didn't get there because they just stumbled into it. They have to have a heart for the service member and their family, and because they are a service member and they have families too. And but they have a lot of things on their plate. We don't always see it, but it's a job, and you're not just on the job for like just that day. It's like you're on the job 24/7,
right?
And it's important. I know our CO just came back and he said they can't emphasize enough work-life balance, and that's just it resonates through all of the things that we talked about at the conference for the last.
I think it's important for our general public to hear that, because I think our military sets the tone for who we are as a country and who we want to be. And to hear from the top down that the military is saying, no, we want you to leave here better than when you entered, that work-life balance is important, that mental well-being is important. If our military, the ones that protect this country and support us, is saying work-life balance is important, well-being is important, then every other company in America needs to be saying that.
We have one of my colonels, I'll just quote him. He said, we have a tragedy of treasured resources. But the hardest thing, I think, is to get the service member and their families to connect to those resources. Because, by the time you go to work for 8 or 12 hours and you want to come home, you don't want to talk with your spouse about, today we had a brief on blah, 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 about, personal finance management and yada, yada. And a lot of times there's a disconnect. So we do provide a lot of opportunities for the spouses to connect. I think I was sharing the other day about one of the classes we have is called Baby Boot Camp.
Love that.
So before, the first child or the second child or the third child, we have a family care part of behavioral health that actually helps the service member get the things set up in the home. They have actual registered nurses that work with them and come in the house and say, hey, this is what you need. And this, a brand new 18, 19-year-old. Can you imagine living in base housing away from all your natural resources? And you have this nurse that comes in and says, hey, we're just going to just help you. And if they attend the baby boot camp, they get a free pack and play. They get a free car seat. They get a free backpack full of all these.
Those are expensive things. That's awesome.
They're just things to help them be more successful, because you know what? If the service member has to fight at home under wraps and everything, not fighting, you know what I mean? If it has everything kind of squared away at home, the stress is low at home, they're more capable of going out and doing their jobs.
Well, and I think it makes me excited. Prevention gets a bad rep all the time, everywhere. We say, just say no. That's what so many people think of when they think of prevention. what you're talking about is really, it is evidence-based prevention, which when we think about it, is really just setting people up for success. If we can keep them from, if having a newborn baby, which is a very traumatic, stressful experience for the body, for all these things, right?
Finances,
if we can set them up
that stuff, it's just
so that it is as minimally stressful as possible, right? We're not in control of the birth story or the plan, any of that, right? But if I know when I come home, I've got all this stuff squared away, I'm less likely to then pick up a substance when it gets hard because I've got these resources, right? Like it is prevention at its finest and its best.
When we start peeling the onion back, that's just one area.
Totally. Yeah.
And so today, what is April? April's a lot of things. April's month of the military child. April is prevent child abuse. Child abuse, we see all the pinwheels everywhere. So we've been, the entire month of April, we've been building up to today. So you know what today is?
No, I don't.
Today we're doing a, what's it called? Kicking it for our calls. And we actually we're doing a kickball tournament today all day. I'm not there. Oh. So all my even my MFLAC, Julia, she's about to have a baby, but she's going to be going out on maternity leave. But she's like, "Hey Sam, are you going over to the kickball tournament?" And so for me as the prevention integrator, to integrate that, to get the Marines to sign up and hit that QR code and put a team together, because I say, "Hey guys, this will count for PT." And the winning team will get a 72. I don't know if you know what 72 means. That means time off.
Oh, yeah.
You get a 3-day weekend. And that's the CO says you get a 3-day weekend.
I'm in.
So, we couple stuff like that with that kicking it for a cause to highlight, preventing child abuse, but also gives the Marines an opportunity to go out and put a team together. We've opened it up to civilian counterparts on base, off base that have base access. So we got a big, huge field, and I'm going to be getting a flood of pictures of, hopefully the weather's nice out in eastern North Carolina today, but that's just one thing. And I know May 9th we'll have a base-wide competition, a 5K mud run.
Oh, wow.
So we're doing that. And I invite anybody that wants to come. If you want to come and just come and hang out one day at Camp Lejeune with me and just, shadow me and see what I do, because I go out to the barracks and they do this thing called Field Day. Field Day is basically when they have to clean the barracks.
Mm-hmm.
And they set up in a big block formation. And you know me, there's the military and the service members are being talked to, embarked at by their leadership. And this is what we're going to do today, and yada, yada. Today we got Mr. Sam here. He's going to talk to you a little bit about what's coming up in April. And I come out and first thing I do is go, almost heaven. Mm-hmm. And the whole battalion of Alpha Company goes, West Virginia. You're speaking to us, Sam? And I go into my little spiel, and I try to be brief, be brilliant, and be gone, because I know time is of the essence. We are combating a lot of risk factor areas, everything from domestic violence, child abuse, suicide is a big thing, and I can't go into details on that.
Sure,
but one of the things, my missions being here at this conference is to get some of the lock boxes that we can get for our Marines, because there are Marines that are taking medications and families that have medications in them, whether it's the spouse or the kids, but having storage of lethal means is huge. So I even had a phone call this week. I'm reaching out to get gun locks.
Mm-hmm.
Yeah,
because those are the big risk factor areas. There's a lot of our Marines love their weapons. They love their guns, and a lot of them have their medications they take too. So we're just looking at some of those risk factor areas as well. Not just having children, or housing is huge for our service members too. So these are our risk factor areas, but we do build on those protective factors.
So I know we're probably running a little bit short on time at this point, but I really want, before we do that, how can communities support the work that you're doing? How can our civilians continue to support their military counterparts?
Okay. Well, every month we do an off-base collaborative with Wilmington Treatment Center. There you go, Ms. Falestine. So Ms. Falestine Yagi, and also her counterpart, Carla Roberts. I think it's Roberts. She and her put on a breakfast every month, every fourth Tuesday at the Golden Corral in Jacksonville.
Oh, yeah.
Anybody that wants to come, and it's a time for us, and I think we even talked about it in some of our sessions, about just having a breakfast, having a time where we can all sit down, break bread, and everybody gets breakfast. It's paid for.
I'm
And
in.
everybody shares, and I bring a lot of our folks off the base to it. I invite them, like, free breakfast. All my firefighters, safety guys, they're like, yeah, we'll be there. Well, come on, because it is such a military town. So, but anybody that wants to, I would say that the USO is a very strong force on the base right now. Actually, our USO is on base. So I think it was Monday this week, they just got 5,000 cases of Girl Scout cookies.
Nice.
You talk about a perfective factor. You put a box of Girl Scout cookies in a Marine's hands, they're like, oh my God, I'm not going to make weight this week, you know.
Oh my God.
But, just little small things. Outside my office, I have a lot of resources just sitting on a table. But out in town, we connect not just with Wilmington Treatment Center and all of the folks that come to the table. There's probably 50 or 60 people that come. Churches, behavioral health providers, EMS, all the peer support specialists that are in the community, the ones that are in recovery programs, Hope. I don't know if you guys have ever heard of Hope, but it's out of Carteret County. They all come, and it's just a big, huge web. And not just there, but we're also partnering with like a couple of other off-base entities that are supporting that whole community piece.
So for those that might not be in the East, what would you recommend if someone's listening to the podcast and they're here in Western North Carolina? Who should they reach out to if they want to be more engaged and more supportive?
Well, in every community, there's always going to be some type of recruiter's office.
Okay.
And those are those ones that are not in garrison, we call it, because if you're on base, you're in garrison, but they're out in the community. So there's going to be a Marine recruiter or a Navy somebody, staff NCO. With staff NCO is a non-commissioned officer, usually enlisted. Sometimes we have officers that do go to college campuses. Even they have any of your ROTC programs when kids are getting ready to enlist and go into the military. I think some of the best medicine you can have is just letting them know that they're still connected. I'm still here, and we're still talking to you. Yeah. It's very cliche, and I try not to say it, but if I see a service member out in the community or a veteran, I don't say thank you for your service. I just ask them, how you doing? How are you doing today? You doing good? Doing all right? Everything? You got everything you need? Is there something that we can help you with?
But acknowledging them in some way.
Acknowledging them, but I think it's just super cliche when you go, thank you for your service. Bye. Right. I see somebody wearing a Vietnam veteran's hat, and I have a dad that's a Vietnam veteran. He served in Vietnam, and he is a sufferer of Agent Orange exposure, has full-blown Parkinson's. If I see one of those guys wearing those Vietnam hats, I just say, welcome home.
That's important.
Because that era is a whole lot different.
It is, yeah.
I think about our uncles and grandpas.
Yeah, my father was Vietnam vet. Yeah.
So just welcome home, man. Just welcome. They didn't get it
right
back then. But
well, I think there's, Sarah, you mentioned it earlier. Like the military protects us. They do a lot of sacrifice personally to do the job that they do, and I'm really thankful that the military is investing in this piece.
They have so many resources. It's ridiculous. They don't have to go anywhere. They have all the behavioral health stuff they could ever need. They have all this stuff is free. They don't have to go out, and there's no billing for it.
It's incredible.
Unless they go off, if they go to medical, if they go to that tertiary level,
sure.
they have their insurance is there.
Yeah.
TRICARE is there.
Yeah.
But, many of these resources are free. There's, single Marines have the Single Marine Program, the SMP, provides a lot of volunteer hours for the Marines that are fun and engaging. Trips they can take. They go to Busch Gardens. They have trips to go to Vegas.
That's so
even
fun.
Dave and Buster's. Is that one of those things where there's like an adult arcade?
Like Chuck E. Cheese for grown-ups.
Oh, my God. Yeah. But so, they do a lot. I hate for them to say, we still have nothing to do. It's just the perception.
Sure.
When they come in, because, when they start listening to the adults, it's like Charlie Brown teacher. Wah, wah.
Well, I even think of my nieces. Their new question lately is, what we can do. And I'm like, your house is full of toys and games and books and puzzles. There is plenty we can do. And it's, there's this, what we can do. We got all kinds of stuff for y'all.
To educate yourself a little bit better, if you really want to know, there are online virtual trainings that you can go to that are free. You just got to sign up for them. You can go to mccslejeune-newriver.org, and there's a whole section that says events. And if you go to that website, mccslejeune-newriver.org is the website. You go to that website, you're going to see all the things. There's comedy shows, there's movies, they even do sometimes they have nights where they do whiskey tastings, and they pair it with food. They do a lot of live entertainment.
Probably not on our podcast are we advertising the.
We're probably not going to advertise that, but they have lots of engaging activities that are going. One of my favorites is for young mamas with kids under 6. They have a play day every Tuesday over on Base Housing, and they get the young moms to come out, and that puts the moms together, and the kids, have their little time, but then that helps them to kind of, these young, just out of high school, some of them, living in this strange town, but they can infuse them in with that. But there's a class called Links, Links, Links. And you can, if you got a child or a family member that's part of the Marine Corps, I would highly recommend sitting in a Links class. And Links is another acronym. There's so many acronyms.
I know
but it's basically learning the lifestyles. What are the lifestyle of being in the Marine Corps is like, and they feed all those resources that you would want to be aware of.
Nice.
It's great for spouses to attend that. It's great for moms, aunts, uncles, and the virtual element. That one of the things that COVID taught us was really nice to have that. So a lot of our classes are virtual.
Nice. Awesome. Nice. Well, Sam, thank you so much for joining us and telling us a little bit about what you do and how the military is supporting our active duty soldiers.
Yeah. It's inspiring to hear what they're doing and how they continue to evolve and adapt to our soldiers' needs. So thank you for what you do.
Yeah.
Thank you for your service to our country. And I mean that I know we talked about it being a cliche, but you are providing an important service.
Yeah, every day is just like a new snowflake, but there are certain things that are set up. I can't really on camera talk about some of the other things that I have, because I have to go into some dark places too and help them navigate the ones
we're grateful you're there for that.
Yeah.
For all of it.
And there's, the subject matter expert Marine that comes in, they're expert at what they're trained to do. And they're allowing more and more of a civilian embedded fighting force to come in now and be a liaison and be a support to the commands. And that's what they haven't had it for a long time. They had their chaplains. I don't know Father Mulcahy and how supportive he was in that show. And a lot of the chaps are like that. Like, we're getting ready for Vacation Bible School. We're already gearing up for that. So I'm working with my chaps on that to work with the base chapel. And so here comes the summer.
Yep,
that's awesome.
Back around. So thank y'all for having me. I mean, I know we get to see each other at these conferences, but really, what do you do?
I know, yeah. It's fun to hear conversation outside of running the karaoke booth, what you do.
I was running the Spring Fling DJ the Thursday before I came here. I was out there. We had 500 pizzas we ordered from Domino's.
Oh,
and we have 1,500 Marines just descended upon our lovely Spring Fling. It was great.
That's amazing.
Brought their dogs and their kids, and they had the Easter egg hunt and all that fun stuff. So it was great.
That's awesome.
Well, thanks for being here.
Well, thank y'all very much.
I had no idea that the military did so much. I knew they did so much. Let me stop and say that. But what I mean is so much for veterans from a well-being prevention point of view. That is so critical. And it's almost the hidden secret we didn't know about. Mm-hmm. They know about it, as Sam said. But I don't know that we as civilians had any idea just that emphasis on well-being and how critical it is. I'm so thrilled that we talked about it.
Well, and for those of us who love service members, to be able to now say, hey, if you go to certain people on base or at your duty station, there are resources. We can be advocates for them when they can't necessarily figure out how to advocate for themselves. So it helps civilians who love service members say, hey, there actually is help for you, and I can help you find it. I think that's really exciting for us.
And our podcast is called Connections, another opportunity to connect with really critical resources. So thanks, Sam.
Awesome.